I didn't start my career in health. I started as a lawyer. What took me there was social justice. I wanted to help build a world where everyone can thrive. Early on, I escaped a corporate law firm, not Freehills, another one, to work on human rights with AusAid in Cambodia. My focus was housing, but what struck me there wasn't just the shelter that people lacked, it was the health consequences that flowed from it. I began to understand that health isn't just a medical issue, it's economic, and if you improve health, you improve everything. That experience stayed with me. It led me into global health and eventually back here to the George. I realised that the world's biggest killers, heart disease, type 2 diabetes, cancers, aren't spread by viruses or bacteria, but rather by what we're sold and what we consume every day. Harmful products like tobacco, alcohol, and unhealthy food. As a lawyer, this is where the action is for me. I believe that regulators, not just doctors and medicines, can save lives. In Australia today, 2 in 3 adults and 1 in 4 kids are overweight or obese. But 40 years ago, it wasn't like this. I don't believe that this happened because of a massive failure of willpower. What has changed is our environment. When I walk out of the train this afternoon, I'm hit with ads for Uber Eats. The ends of my supermarket aisles are covered in 2-for-1 Tim Tams. Exposure to food marketing starts long before kids can read nutrition labels, and we know that most adults can't really read them either. The products that are marketed and sold by the processed food industry are packed with salt, sugar and fat, and they're making Australians sick. That doesn't seem fair to me. But there is an alternate future, one where our food system can put health before profit. My work at the George is powered by our Food Switch program. The app that we have lets shoppers scan products and get information on the healthiness and sustainability of foods, as well as better alternatives. But while this supports consumers, it gives me something even more powerful: data. It shows us at scale what's really happening in our food supply and how that's changing over time. It's the evidence that we need to convince decision makers to set higher standards for how the food industry make, market and sell food. For example, I believe that unhealthy foods need to be clearly labelled and easily identified. And my work examining the Health Star rating in Australia has been a key focus of that. The label rates foods from 0.5 to 5 stars to give people simple, at-a-glance nutrition information. And over the past decade, our researchers highlighted the huge potential of this policy. But it's also really held the food industry to account for very poor voluntary uptake. Recently, with other health groups, we had a really major win in this space, with food ministers committing to mandate and improve stars so that all Australians can get access to clear, reliable nutrition information on every packaged food. Because changing a small star on a box can change what millions of people eat. We all know that Australia is a global leader in tobacco control, and we could lead the world in food policy too. My ambition is simple. I want my son to be able to get to school without being bombarded by junk food ads. I want him to walk into a canteen and see fresh, healthy food as the norm, not the exception. Food is something that every one of us touches daily. I know this because if I mention my work at a dinner party or even here tonight in the early discussions, I know that everyone's got a strong opinion about this stuff, whether it's health stars or sugar taxes or what's in kids' lunchboxes. We all eat, we all care, we all have a stake. Pun intended. My goal now is to accelerate this work, and with ongoing investment into Food Switch, I can really keep driving the evidence base, I can strengthen our advocacy, and we can create the momentum that's needed to shift food policy at scale. Because to me, better health isn't just about treating disease, it's about setting the rules that prevent it in the first place. Thank you.